Hey, I'm Seal with iCore Connect, and we are a TDA Perks endorsed partner. And I'm here today with Robert McDermott, our president and CEO. And we are talking about the pitfalls of written, faxed, and called in prescriptions. So, Robert, what are you seeing as the biggest consequences happening in practices who are still using these methods to prescribe?
Hi, Seal. Yeah, I think there are many pitfalls when prescribing the various options you just mentioned. Now, let's start with the fact that many states, it is now the law to electronically prescribe. Some states currently have this requirement to prescribe controlled substances. Others have all prescriptions, not just controlled substances. Let's start with that. The second thing I'd like to talk about is a few of the benefits of e-prescribing. You have speed, accuracy, access to multiple pharmacies, and much better patient care, to name a few.
So, thinking about all of the kinds of things you can do with e-prescriptions, Robert, we, of course, are endorsed by the Texas Dental Association, the TDA Perks, for iCore RX, which is our cloud e-prescribing software. What is it about iCore RX that stands out as much more than just a way to digitally send a prescription?
Yeah. So, like so many of our additional products, we've added unique features that do much more than just meet the minimum requirements. You mentioned our e-prescribing software is cloud-based, which means that the doctors can access it remotely while not in the office and from any internet-connected device. This allows them the ultimate freedom to take care of their patients outside the office and provide tremendous customer service with their patients. Many of our doctors are using a local or server-based practice management software like Dentrix or EagleSoft, and our cloud e-prescription software is a real game changer for them as we integrate with most. In addition to our software being in the cloud, it allows the doctors to see the additional medication history from all healthcare providers, including first-time patients. This eliminates adverse drug events and reactions from allergies as this information is right at the doctor's fingertips. The software also has the ability to build formularies, drug set compounds, frequently used doctors, favorite lists, speeding up the process of e-prescribing as well. And I think an additional feature we have is the ability to connect to the many state PDMP, PMP websites when prescribing a controlled substance. This is a big time saver as we keep them in their current workflow versus leaving their current software to log into a different website. A single button in our software will take them to the respective state website, date and time stamp the visit, and allow them to be in compliance with their state laws.
And Robert, with Texas specifically, it's the electronic prescribing law has been in effect for a few years now. Why would you say this is a good time to reassess, look at where you are as a dental practice and whether the e-prescribing software that you have is actually working for you, and or are you still doing multiple things, writing prescriptions over here for one and e-prescribing over here for two? Wow. What's the benefit to take a look now and really reassess your workflow?
Yeah, so I think a lot of them want to comply with the law, so they made quick decisions and may have not looked at the feature set. One of the things that sets us apart on our e-prescription software is the many, many unique features that we have in our software. I named a few here: medication history, allergies, connections to the PDMP websites. It's cloud-based as well, which means the doctors can still have a server-based system, a local-based system, and access their database remotely in the cloud on any internet-connected device. So it's not an app either. It's not on one device. It's actually a website. So again, they can connect to any internet-connected device. It gives them the ultimate freedom and the ability to serve their patients.
Yeah, I mean, we really hear a lot about speed, that it just speeds it up and it's so much more productive. Is that a pretty accurate assessment?
Absolutely. We can get through the entire process if you have a doctor's favorite in less than 5 clicks.
Wow. All right. Well, thanks, Robert. I appreciate it. And if you're a TDA Perks member, the beauty of all of the products endorsed by iCore Connect is that you get a substantial discount. So we will hope you check out iCore RX just by clicking the Book a Demo button and see what it's all about.